Hello, this is Dr. Trivedi, a doctor working here today. May I confirm your name and age, please?
Hello, doctor. I am Samuel Jackson, 62 years.
Okay, how may I address you?
Please call me Samuel.
Okay, Samuel. May I know? Today we are going to discuss about your health issues. Is that all right?
Okay, doctor.
During our discussion, I might take down some notes, which will be strictly confidential. Is it okay?
Okay, doctor.
Okay. Well, Samuel, can you please, Mr. Samuel, can you please tell me in your own words what have brought you here?
Actually, doctor, I am not feeling well for the last 2 weeks. I feel a little shortness of breath when I try to hurrying up, but I could manage it because I am a sedentary lifestyle maintaining person. So it was nothing serious for me. But about 3 days ago, I noticed that I have a fever, I have runny nose, and also cough, and I produced some blood in cough. That was some o-ring. So I visited my GP, and I for the last 1 year I had two times this type of symptom. Like I had some runny nose, cough, but I never produced blood before. And this time my doctor suspected that I have sinusitis or something called lung infection. So he gave me antibiotic, and I was taking that, though that was not helping me much. And today morning I noticed that I am passing a red color waterwork. So that is very worrying for me. Then I urgently visited my GP, and he thought that there might be some. He said that there is something called there might be some called, I cannot remember the term, but he said that there are some abnormal clotting problem. So he urgently sent me here.
Okay, I can understand your fear. I will try my level best to find out what's troubling you. And may I know that you told that today morning you noticed some blood or the red color in a waterwork. May I know that is this the first episode that you have ever experienced?
Yes, doctor.
Okay, and okay, and now, can you please explain that when did it start? In the
When I
morning,
passed water in the morning, then I noticed, and till morning I noticed it 3 times. Passed
3 times.
every time. Yes,
Okay,
doctor. Every time I pass my water, I noticed that.
notice that. Is it just totally red or something darkish? Can you please remember?
Totally red.
Totally red. Okay. Have you felt any burning sensation while doing your water work?
No.
Okay. Any well okay, and well any how severe was it? Can you please tell me
I
how much?
noticed some redness in my water work, and I cannot tell you that how much severe. It was not
Okay, okay.
that like I am passing blood, full blood. It is mixed with my blood.
Okay. And may I know that do you have any rashes in your private parts?
No.
It's actually some question. Okay. Any okay, any rashes in your private parts? And you told that you had some episodes of runny nose and cough for the last 1 year. Can you please specifically tell that when did the first episode took place?
About 1 year ago,
About 1 year ago. And what happened at that time in the first episode?
I got a runny nose, some nasal stuffiness, and
Yeah.
somewhat low rise of my temperature. So I visited my GP. He told me that I have sinusitis. He gave me an inhaler and paracetamol tablet. Usually, that persisted for 3 or 4 days, and after that, it went away.
After that, it went away. Okay. Was your water work all right at the time?
Yes, doctor.
Okay. And when did the second episode take place?
That was from the about 7 to 8 months ago.
Okay, and at that time were all the symptoms same, or did any nothing new something occurred?
Something occurred, that is, I had some problem with my hearing at that time also. I had some heaviness in my right ear at the time, and
Hmm.
I told my GP. He made an appointment, but I missed that, and till now I am waiting. That is not something serious for me, so I am not going for that urgently.
Okay, okay, okay. And so for the last time, okay, and for the last time, this you told that I think 3 days back. Well,
Yes,
did you
doctor.
had any raised temperature
Yes,
this
doctor.
time? Okay. Did you measure it? How
No,
much raised was it? Okay, is it continuous or does it come and go? This raised temperature?
no, it is present all over the day.
Okay, okay. And is there any chills and rigor?
No,
Okay. And you told that also there has been some cough presented. Okay.
yes, doctor.
And okay. And was it present for at this from the same duration for the last 3 days, or did it come later on after the
Last three
raised
days.
temperature? Okay. And okay. And all the can you please describe the cough for me? That how much how thick or thin it is? Can you please tell me?
Doctor, 3 days ago, initially I cough was for few times cup was dry, and after that I produced phlegm. And for last 2 days I noticed blood in my cup, blood in my phlegm.
Okay, can you please tell me that is it frank blood or is it mixed with your phlegm?
Mixed.
Mixed. Okay, and can you please give an idea about the amount of the blood phlegm produced?
No, cannot tell you exactly.
Okay, well, do you have any chest pain this time?
No.
Okay, any shortness of breath?
Yes, doctor. For the last 2 weeks I have a shortness of breath, but I could manage that. But for last 3 days it is somewhat very much affecting my life.
Okay, okay, I can get it. And okay, and do you have any? Okay, let me ask you some other questions now. Do you have any headache?
No,
Okay, any changes in your vision or any problems in your vision?
no,
Okay, any soreness in your mouth?
no,
Okay, any joint pain?
no,
Any rashes?
no,
Any difficulty in swallowing or speech?
no,
Okay, any problem in any weakness in any part of your body?
no,
Any burning sensation or abnormal sensation in any parts of your body?
no,
Okay, any loss of consciousness?
no,
Any racing and pacing of your heart?
no,
Any noisy chest? Have you noticed, or chest tightness?
no.
Okay, and what about your water work normally? This is this time you have told about some red colored urine, but what about normal your normal water work? Is it normal altogether?
Yes, doctor.
Okay. Mm. Do you have any feeling of poor flow or dribbling?
No,
Okay, that's all right. Any burning sensation while having a water work?
no, doctor.
Okay, that's all right. And may I know what about your bowel motion? How is it?
Normal.
Okay, that's all right. And okay, that's all right. And have you noticed any blood in your bowel motion or anything, any
No.
mucus? Okay. And you told that you had some hearing problem in the second time. Now may I know how is your hearing now? Hearing
Remain almost same, but somewhat improved.
somewhat improved. Okay. You didn't get any treatment for it. Am I right?
No, my GP just gave me some inhalers and paracetamol, nothing else.
Yes. Okay. Well, may I know that for this time, have you been on any medication?
My doctor gave me paracetamol and amoxicillin.
Okay. And how many paracetamol tablets are you taking, and how much ampicillin are you taking? How many?
3.
Okay. And have you noticed any betterment of your condition since taking this?
No.
Okay. Any over-the-counter medication?
No.
Any herbal medication?
No.
Any blood transfusion?
No.
Any okay, I'm sorry to ask, but any recreational medication?
No.
Allergic to any medication?
No.
Well, do you have any known medical condition?
I have high blood pressure for last 5 years, and for that I am taking thiazide.
Okay. Well, have you been under regular follow-up for your blood pressure, high blood pressure?
Yes, doctor, it is under control.
Okay, that's very appreciable. And may I know that okay, do you have any known history of clotting problems?
No.
Okay. And do you have any family history of such illness or any long-term illness?
No.
Any history of sudden death in your family?
No.
Okay. May I know what you do for your job?
I am a retired person. Before that, I worked at the factory as manager.
In a factory manager. May I know what type of factory?
Paper mill. Doctor.
Sorry,
Paper mill.
paper mill. Okay. Well, were you exposed to any types of dye in that mill?
No.
Okay, that's all right. And may I ask you some other questions? Do you personal questions? Do you smoke?
Yes.
How many sticks for how long?
About 5 sticks per day for about 40 years.
Okay, I can get it. Actually, it's very harmful for your health, and it's better if you quit it. And if you want, we can refer you to the smoking cessation clinic. Is that all right?
Okay, doctor.
Do you drink alcohol?
No.
Okay, and may I know that have you been to any travel recently to any other
No.
countries? Okay, and may I know whom do you live with?
My wife.
Okay, and are you well supported financially and socially?
My wife is a bedridden patient, doctor. I have to take care of her.
Okay, I'm sorry. Well, in that case, we will actually involve the social services so that they can help you more in this matter. Will it be okay?
Okay, doctor.
Okay, and well, I have to ask another personal question, though it's very personal. Do you have any other casual relationship other than your wife?
No.
Okay, I'm very sorry to ask, but I had to ask it. Okay, and may I know actually what your concern is?
Yes, doctor. Is it any problem with my clothing? Am I going to die?
I will get to it. Well, just may I ask you just some more questions? Do you have any loss of weight? Have you noticed?
Yes, doctor.
How much weight can you specify?
About 5 kg over the last 3 months.
Okay, is it intentional or unintentional?
I haven't any intention to lose weight.
Okay, that's all right. And any weather preferences?
No.
Okay. Any lumps and bumps anywhere in your body?
No.
Any lumps and bumps in your tummy?
No.
Any discomfort that you feel in your tummy or any pain?
No.
Okay, that's all right. Well, now, well, Mr. Samuel, at this moment, actually, I have to examine you properly and do some thorough assessment by doing some blood tests and also some scanning tests. And after that, uh, I can get to you with a far more better explanation. But as long as I have taken history from you, I think that this the symptoms you are having might be due to a condition named Wegener's granulomatosis or granulomatosis with polyangiitis. Have you ever heard the name?
No.
Okay, please don't bother about it. Actually, it's a type of disease in which the blood vessels of your body uh, can get inflamed. Actually, specifically the blood vessels in your upper chest side and also of your waterwork part. Okay, in those parts the blood vessels can get a bit affected, and sometimes it can cause some bleeding from both your chest and urine and waterwork uh, mechanisms. Are you getting me?
Yes, doctor.
Okay, so at this moment, actually, we will involve the kidney doctor and our consultant so that they can run the tests and uh, map out a plan as soon as they get the test results. Is that all right? And at the same time, actually, it will be better that if you quit smoking by going to the smoking cessation clinic. Is that all right, Mr. Samuel?
Do I need admission, doctor?
Well, actually, at this moment, we will have to at first. I will have to at first talk with the consultant over this matter. But since you have had some um, red episode of red color waterworks and having some red flame production, it might be needed that you it might be that you would be kept under observation as long as we get some appropriate test results. Are you getting me?
Doctor, I cannot be admitted because I told you I have to take care of my wife.
Okay, okay. We will actually involve. We will. I will let it know to the consultant and social services, and we will uh, try to do whatever needed in this case. Is that okay with you?
Okay, doctor.
Okay. Any more concerns?
No.
Okay. Thank you, Mr. Samuel.
What is your diagnosis?
I think this is the diagnosis here is Wegener's granulomatosis, or what we say that granulomatosis with polyangiitis.
Any other
Here,
differential do you have?
yes, I have some differentials here. I think the patient might be yes, he might be suffering from anti-GBM, like anti-glomerular. Sorry, not anti-GBM. I'm just forgotten. Uh, Alport syndrome. I think the patient can also be suffering from Alport syndrome, and and he might be okay, and he might be suffering from. Uh, I think these two will be the main differentials here regarding bleeding from regarding both hemoptysis and hematuria.
Do you think Charcot syndrome can be differential?
Stark could have been a differential, but actually, since I ruled out that he didn't have any type of chest pain, sorry, chest tightness or any weakness, so I actually didn't keep it in the differential, but it can be.
Okay. I will investigate.
Okay, at first I will have to I will have to do some routine blood tests like CBC, uh, and to also see the ESR and TRP. Then I will have to go for some autoantibody tests like CANCA, PANCA, ANA profiling, etc. And then I will have to do some chest X-ray PA view, and at the same time, I might have to go for some his pulse oximetry studies and also urine routine microscopic examination and serum creatinine, and if needed, maybe ultrasonogram of abdomen.
How will you manage him?
Actually, we in this case, uh, I think have to we should admit the patient and also give him a high dose steroid, and if needed, some other immunosuppressive agents. And if not improved, I think we might think of plasma exchange.
Do you think involvement of the multidisciplinary team would be more beneficial?
Oh yes, actually, sorry. At first, patient education and counseling, then by multidisciplinary team formation by involving the involving, I think, the nephrologist, the rheumatologist, and also I think the social services actually here. Okay.
Okay.
And
Okay,
and
no
then
problem with you.
giving
Well, you are very sleepy. I can understand. So why now?
okay. Hello.
Yes.
Now, okay, you can just criticize me, no problem.
Okay.
Just,
Everything was fine. Just a few things that for
yeah,
this
yeah,
gentleman, your history taking was somewhat that you asked about past history at a very late stage.
yeah, 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 yeah.
Okay, and in the previous and in the primary history, that was fine.
Mhm.
Yes, there was nothing more significant that I can tell you.
Okay, so I think we can complete it today for today. Okay.
Okay.